Nobody is interested. We will just read out. Okay. So in each room. So you are
Shall I
ST5.
try, ma'am?
Yeah. Okay then. Start.
1 second. Okay. Next page, ma'am. Next page, ma'am. Next page, ma'am. Next page, ma'am.
Starting 10 minutes.
Okay. Next child, ma'am. Sorry, next page. Next page, ma'am. Next. Next, ma'am. Next page, ma'am. Okay. First page. Hi, I'm Muthulakshmi, one of the exam candidates today. I read the instructions and ready for the discussion. So, my first patient is breast and vaginal discharge in a 10-year-old girl with 3 months. So, it is for examination under anesthesia. So, this procedure is appropriate. Okay. So, done as a daycare procedure and should be done as soon as possible. So,
Okay.
and since the possible diagnosis being maybe any foreign body inside, and we need to ask insensitively about the sexual history and rarely any malignant conditions. Additional investigation. So, here complete blood count, group and say we needs to know, and any
Okay.
high vaginal swab can be taken.
Okay. Your next
And the
case.
next patient is incidental finding of ovarian cyst of 10 into 15 centimeter, but she also had a suspected carcinoma of colon. So since this patient is needs further evaluation, has to be done as an inpatient. So and also her support system needs to be inquired, and this case has to be discussed in MDT, and she needs detailed investigations. Her basic blood counts, complete blood count, liver function, renal function, and CA 125, and her performance status needs to be checked. And also, she any endoscopy needs to be done, whether she will be fit for the surgery needs to be taken, and any family history of cancers, and whether it is a any syndromic features we are suspecting, so needs to be evaluated. Then after that, whether depending on the stage of the disease, depending on the performance, depending on the MDT opinion, further plan will be done. Uh, but since it has to be done, all this workup as soon as possible because it is suspected carcinoma colon.
Okay.
Then any MRI needs to be done, has to be done for staging purposes. So next case, so for total abdominal hysterectomy with hypoplasia with focal areas of ATPR in a 66-year-old. So this has to be done as an inpatient. The procedure is appropriate. So additional investigation. So her basic investigations like complete blood count, all the liver function, renal function grouping, and pre-anesthetic checkup has been done. Has to be checked, and imaging has to be checked. So, and we need to check whether this sample was hysteroscopic sample or a Pipele sample. So, before posting for procedure. So, this as a inpatient, as it will be done in the routine case in the list. And any medical surgical comorbidities needs to be checked for this patient before planning for a surgery. Next, ma'am. So, next patient for a diagnostic primary infertility with a deep dyspareunia for diagnostic laparoscopy and diet test. So this patient was done as a daycare procedure. The procedure can be done uh, as in the routine basis. So here we need to additional investigation. Her basic counts, we need to rule out pregnancy and the sexually shared infection, and we need to check the ultrasound for any suspicious feature of endometriosis because she has deep dyspareunia. So accordingly, we need to get a concern for the patient if an incidental finding of endometriosis is found out. So what to do further has to be explained to the patient. And whether other investigations for the infertility like ovulation, semen analysis has been done, and it was found to be normal, we need to check before posting her for a diagnostic laparoscopy in the routine list.
Okay.
Next, ma'am.
Next.
So the next patient is diagnostic laparoscopy for deep dyspareunia and menorrhagia. And her risk factors are severely asthmatic and uses two inhalers. So here we need to check whether this procedure is appropriate or not. So whether she has been tried any medical management or like a Mirena intrauterine devices has been tried before has to be checked because she's on inhalers and we are planning for a general anesthesia, so it might come as a high risk, and we need to check her investigations for the asthma, whether her lung function is normal, whether she pre-anesthetic checkup has been done, and whether she is fit to undergo procedure. So this needs to be discussed with the consultant regarding appropriateness of the procedure, and if at all appropriate, and it has been done as a inpatient, and after ruling out her pregnancy and the sexually shared infection and asthma control. Otherwise, she can be tried medical management. So, carcinoma cervix for examination under anesthesia, 40 years. So, risk factors are hypertension, arthritis. So, here we need to get check the hypertension control and the uh, orthopedician opinion. So, regarding any specific things during the surgery, and this procedure has to be done in the uh, OPD and as soon as possible because it is suspected invasive carcinoma, and any all additional investigation, her complete blood count, group 1 save, and renal function, liver function needs to be checked, or any involvement or any distal metastasis which involving ureter, any metastasis or any urinary tract infection she is having, and she will be offered an ultrasound abdomen and pelvis. And her regular medications will be continued during the procedure.
Okay.
Next, ma'am.
Done. Anything else you wanted to say in any of the room? Completed. Completed well within time.
Okay.
Okay. Very well attempted. Okay. The only room what you have not rightly said is this room. This is focal areas of atypia. What do you think? How you will prioritize?
As soon as possible.
Yeah, you mentioned routine.
Yes, ma'am. Okay. Okay, ATP. Okay.
So this is
Mm.
the most important patient safety. Rest everything is normal. Anybody is having any means comment on her performance? No. Okay, so very nicely done. Almost most of the time you had mentioned how the procedure, whether procedure is appropriate. Once or twice you miss out on appropriateness of the procedure.
Mm.
Okay, so see to it. You will be in this case. You are not supposed to take any history, anything. So you just need to mention whether the procedure is appropriate or not. Mentioned urgent, not urgent. Mention urgency. Then what exactly you wanted to go for that case, you just say. Okay, don't directly start saying by what you are requiring. Okay, so appropriateness is the first thing which you should be coming. In the first second room you had mentioned it is appropriate, but then later on in the room where it was not appropriate, in that room only you mentioned that it is not appropriate. We can wait in this case because the patient is having multiple risk factor, so we can offer her medical line of management. So that was your comment on that dysmenorrhea with last room. Okay, so there
Okay.
again you brought that appropriateness. In between two or three rooms you just missed out on that. Hmm? So remember that.
Yes, ma'am.
So rest the points was very nice. Okay, so here my answer key is almost similar to your. So yes, appropriate, because I wanted to rule out child abuse. That is more problematic, and foreign body as rightly mentioned. So it will be day case, urgent, on urgent basis. So here I will be taking a drug history whether the patient is on any drugs. Okay, whether the patient is on any drugs, any cyclicity of bleeding. Okay, pubertal milestones, whether it is pre-pubertal bleeding or it is just abuse or it is just trauma. Would like to take that pre-pubertal milestone, assess her Tanner stage, rule out trauma, sensitively ask about abuse, admit into pediatric ward. Very important. Huh? Admit into pediatric ward, and then arrange a investigation like full blood count, swab, urine routine, microscopy, and if needed, abdominal scan also. Incidental ovarian cyst in elderly postmenopausal woman where the suspected CA colon was suspected. So very nicely you had mentioned so many points which I forgot to mention. But yes, you can just take a input from MDT. But this and performance status. Okay, you assess the performance status of the patient, assess the overall condition, assess whether she is fit to undergo surgical risk, anesthesia risk. So anesthesia review, if needed, we can take a put her into MDT, CA125 and calculate her RMI. So here the answer they had mentioned was aspiration, because the patient is very frail. So either interventional radiology and percutaneous drainage of the ovarian cyst. Since it's a simple cyst, what they had mentioned. If RMI is suggestive of non-cancerous etiology, we can definitely offer her a more conservative approach like percutaneous drainage, but minimal invasive approach. Okay, minimal invasive, that is percutaneous ultrasonographic guidance of drainage of the ovarian cyst fluid. But if she comes out to be malignant, then yes, the MDT will be deciding her fate. Very nicely mentioned. So you can involve here MDT, and this is also again urgent. This will basically, here they had mentioned appropriate, they had mentioned. So here, rather than all these points, I will definitely answer the way she has answered that. Okay, I will refer this case to the MDT because suspicion of CA colon along with ovarian cyst, arrange CA125 and calculate her RMI. Depending upon that, the MDT will decide whether she will requiring, if her she is non-benign, she is non-cancerous or benign pathology, then yes, definitely she can be offered a minimal invasive method like ultrasonography guidance tapping of the ovarian cyst. Okay. Then THBSO in view of endometrial atypia. So this is again an important case because she is at risk of CA endometrium in view of atypia, which you had mentioned whether it is a PPL biopsy or histoscopic biopsy. You wanted to know. 2-week pathway IPD. Additional information here, you wanted to review the risk factor for endometrial cancer like obesity, nulliparity, PCOS, diabetes, hypertension, and fibroids. Additional investigation here will be PAC, and yes, you can actually, since it is not a suspected endometrial cancer, I am not saying MRI, but if one can wanted to say if there is high risk of high suspicion of CA endometrium, then MRI can also be offered to this case along with PAC. Lapenda in view of dyspareunia and primary infertility. So this is going in favor of endometriosis. Okay. So yes, appropriate routine day case, additional information and alternate management if appropriate. So semen analysis for partner, ovulatory functions are normal or not. We need to check that by sending her serum progesterone day 21. STI screen is very important. If not done, please please consider IV antibiotics and injectable and the antibiotic prophylaxis for STI. LMP, UPT needs to be offered. Very important. And additional investigations. Once the complete investigation has been done, the patient can be posted. This is a routine case. No need to hurry here. Okay. This case very nicely again elaborated by Dr. Muthulakshmi that yes, it's appropriate, but yes, medically high risk patient she is uncontrolled asthma. Anesthetist review needs to be done. What treatment she has tried, whether she has tried LNG IUCD or not, we can offer her that also if not tried, and then we can think about going ahead with the surgical plan. But if the patient has been offered all the medical line of management, including LNG IUCD, then yes, this is an appropriate case, a routine case, daycare. We can offer her alternative management if fit into, otherwise can go ahead with the planned management what we are deciding. Okay, again here it is very important to rule out pregnancy. Here semen analysis and ovulatory dysfunction is not needed because the patient is not going for infertility workup. Okay, PAC and pulmonologist workup is very important because she is a case of asthma. This is CA cervix for examination under anesthesia, 2-week pathway, that means top urgent or urgent. Appropriate case, information alternative management in this case will be review by anesthetist because the patient is hypertensive, patient is having this arthritis. Yes? Osteoarthritis, something like that she is having, no? Severe arthritis affecting T-mandibular joint. Okay. Hypertensive, so she will be seen by the medicine person for her hypertension control, and at the same time she will be either seen by the ENT surgeon or orthopedician for her arthritis and medicine reference. So these two people are going to see her, but this doesn't mean that she will be postponed. Her condition will be optimized and she will be assessed by for pre-anesthesia checkup, and depending upon the category, okay, depending upon the category, she will be undergoing this procedure as early as possible within 2 weeks time. Okay, PAC, full blood count, urea electrolyte, LFT, chest x-ray, MRI pelvis, CT of abdomen or USG of abdomen pelvis for staging of the disease. Okay, so all these points are very important. Very nicely done. So when it comes to domain-wise scoring, information gathering, discuss appropriate investigation for each of the patient and the information to be obtained from the investigation. Synthesize the information provided in each letter and then use it correctly, and planning and management. Communication with patient and families, introduce self-role, ability to communicate to each patient, need for further investigation, when to come to the clinic, ability to explain the rationale for classifying case of routine, urgent, soon. Communication with colleague, ability to prioritize each case appropriately into urgent, soon, and routine, able to synthesize the information in enough detail to ensure management plans are clear and easily understood by the colleague, involve the care of the patient. Those requiring additional input, ENT, respiratory physician, pulmonologist, needs to be involved whenever possible. Ability to identify additional expertise required for each case and prioritize accordingly. Patient safety, aware of the possible consequences of delay in seeing patients on the waiting list, has an understanding of the need for additional investigation to ensure correct diagnosis and treatment. Knowledge of various common gynecological problem, ability to critically appraise the information provided in later to arrive at diagnosis, ability to initiate appropriate investigation to confirm diagnosis and make management plan, working knowledge of roles of other members of MDT to ensure best care for the patient, knowledge of appropriate levels of various NICE and RCOG guideline in general, gynecology and government recommendation for waiting time for oncologic cases. Okay. So overall, a good presentation. Okay.